101. What is the primary transmission mode for Creutzfeldt-Jakob disease? A. Airborne droplets. B. Prion exposure, e.g., contaminated tissue. C. Mosquito bites. D. Direct skin contact. Answer: prion exposure, e.g., contaminated tissue. Rationale: CJD spreads via prion from infected tissue, e.g., surgery. Option B is correct. Options A, C, and D fit other diseases. 102. Which symptom suggests worsening spinal cord injury? A. Improved sensation below injury. B. Loss of reflexes below injury level. C. Enhanced muscle strength. D. Clearer speech. Answer: loss of reflexes below injury level. Rationale: reflex loss indicates worsening spinal cord damage. Option B is correct. Options A, C, and D suggest improvement, not progression. 103. What is a lifestyle risk factor for developing tension headaches? A. Adequate hydration. B. Poor posture. C. Regular sleep schedule. D. Low stress levels. Answer: poor posture. Rationale: poor posture causes muscle tension, triggering headaches. Option B is correct. Options A, C, and D reduce headache risk. 104. Which test confirms meningitis from spinal fluid analysis? A. CSF culture and cell count. B. Blood lipid profile. C. Urine glucose level. D. Chest X-ray. Answer: CSF culture and cell count. Rationale: CSF analysis shows infection, e.g., bacteria, WBCs, in meningitis. Option A is correct. Options B, C, and D assess unrelated systems. 105. What is the primary goal of pyridostigmine in myasthenia gravis? A. Reduce blood pressure. B. Enhance neuromuscular transmission. C. Prevent seizures. D. Cure the disease. Answer: enhance neuromuscular transmission. Rationale: pyridostigmine boosts acetylcholine, improving muscle strength in MG. Option B is correct. Options A, C, and D are unrelated or impossible. 106. Which complication is common in advanced Alzheimer's disease? A. Improved short-term memory. B. Increased risk of infections like pneumonia. C. Enhanced mobility. D. Better decision-making. Answer: increased risk of infections like pneumonia. Rationale: immobility and swallowing issues in late Alzheimer's raise infection risk. Option B is correct. Options A, C, and D are not typical. 107. What should a nurse teach a patient with stroke to prevent aspiration? A. Eat lying flat. B. Sit upright and tuck chin when swallowing. C. Avoid thickened liquids. D. Skip swallowing exercises. Answer: sit upright and tuck chin when swallowing. Rationale: upright posture and chin tuck reduce aspiration risk post-stroke. Option B is correct. Options A, C, and D increase risk. 108. Which disorder causes rapid, uncontrollable eye movements? A. Multiple sclerosis. B. Nystagmus from cerebellar dysfunction. C. Parkinson's disease. D. Bell's palsy. Answer: nystagmus from cerebellar dysfunction. Rationale: nystagmus involves involuntary eye movements from cerebellar issues. Option B is correct. Options A, C, and D cause spasticity, tremors, or facial weakness. 109. What test monitors phenytoin toxicity in epilepsy treatment? A. Serum phenytoin level. B. Blood urea nitrogen. C. Lipid panel. D. Thyroid hormone levels. Answer: serum phenytoin level. Rationale: phenytoin levels ensure therapeutic range, preventing toxicity, e.g., nystagmus. Option A is correct. Options B, C, and D monitor kidneys, cholesterol, or thyroid. 110. Which non-pharmacological intervention aids ALS respiratory support? A. Avoid all respiratory exercises. B. Use of a BiPAP machine at night. C. High sodium diet. D. Prolonged sun exposure. Answer: Use of a BiPAP machine at night. Rationale. BiPAP supports breathing in ALS as respiratory muscles weaken. Option B is correct. Options A, C, and D worsen or are unrelated to respiratory function. 111. What is the primary pathophysiological feature of amyotrophic lateral sclerosis, ALS? A. Loss of dopamine neurons. B. Degeneration of motor neurons. C. Excessive myelin production. D. Cerebral artery blockage. Answer. Degeneration of motor neurons. Rationale. ALS involves progressive motor neuron loss, leading to muscle weakness. Option B is correct. Option A fits Parkinson's. Option C is unrelated. Option D is stroke-related. 112. Which symptom is most characteristic of a cluster headache? A. Bilateral dull pain. B. Severe unilateral pain with tearing. C. Gradual onset over hours. D. Constant pressure sensation. Answer. Severe unilateral pain with tearing. Rationale. Cluster headaches cause intense, one-sided pain with autonomic signs like tearing. Option B is correct. Options A, C, and D describe tension or other headaches. 113. What is a significant risk factor for developing spinal cord injury? A. High vitamin D levels. B. Falls from height. C. Regular swimming. D. Low-fat diet. Answer. Falls from height. Rationale. Falls are a leading cause of spinal cord injury due to trauma. Option B is correct. Options A, C, and D are unrelated or protective. 114. Which diagnostic test is most effective for detecting Parkinson's disease? A. Blood test for dopamine levels. B. Clinical assessment with MRI support. C. Urine analysis. D. Chest X-ray. Answer. Clinical assessment with MRI support. Rationale. Parkinson's is diagnosed clinically, e.g., tremor, rigidity, with MRI ruling out other causes. Option B is correct. Options A, C, and D don't directly diagnose it. 115. What is the first-line treatment for managing status epilepticus? A. Physical restraint. B. For benzodiazepines like lorazepam. C. Oral antibiotics. D. Dietary supplements. Answer. For benzodiazepines like lorazepam. Rationale. For benzodiazepines stop prolonged seizures quickly in status epilepticus. Option B is correct. Options A, C, and D are ineffective or unrelated. 116. Which complication is most likely in untreated traumatic brain injury? A. Improved cognition. B. Cerebral edema and herniation. C. Enhanced reflexes. D. Better balance. Answer. Cerebral edema and herniation. Rationale. Untreated TBI causes swelling and pressure, risking herniation. Option B is correct. Options A, C, and D are not complications. 117. What should a nurse teach a patient with epilepsy to ensure safety? A. Swim alone in deep water. B. Avoid driving until seizure-free. C. Cook with open flames daily. D. Skip helmet use in sports. Answer. Avoid driving until seizure-free. Rationale. Driving restrictions prevent accidents during seizures. Option B is correct. Options A, C, and D increase injury risk. 118. Which cranial nerve is assessed by testing tongue movement? A. Hypoglossal, 12. B. Facial, 7. C. Vagus, X. D. Trigeminal, V. Answer. Hypoglossal, 12. Rationale. The hypoglossal nerve, 12, controls tongue movement. Option A is correct. Options B, C, and D affect face, viscera, or sensation. 119. What is a common early symptom of meningitis? A. Improved alertness. B. Fever and stiff neck. C. Enhanced coordination. D. Clear vision. Answer. Fever and stiff neck. Rationale. Meningitis presents with fever and neck stiffness from meningeal irritation. Option B is correct. Options A, C, and D suggest normal function, not meningitis. 120. Which imaging modality is best for diagnosing spinal cord compression? A. Brain CT scan. B. MRI of the spine. C. Abdominal X-ray. D. PET scan of the brain. Answer: MRI of the spine. Rationale: MRI detects spinal cord compression from tumors or injury. Option B is correct. Options A, C, and D target other areas or functions. 121. What should a nurse monitor in a patient with stroke for swallowing issues? A. Hair growth patterns. B. Dysphagia and aspiration risk. C. Skin temperature only. D. Room humidity. Answer: dysphagia and aspiration risk. Rationale: stroke can impair swallowing, risking aspiration. Monitoring is key. Option B is correct. Options A, C, and D are unrelated. 122. Which medication is commonly used to treat acute migraine symptoms? A. Acetaminophen alone. B. Sumatriptan, a triptan. C. Levothyroxine. D. Metformin. Answer: sumatriptan, a triptan. Rationale: sumatriptan targets migraine-specific pathways for relief. Option B is correct. Options A, C, and D treat pain, thyroid, or diabetes less effectively for migraines. 123. What is a key environmental risk factor for multiple sclerosis? A. Living near equator. B. Low sunlight exposure. C. High physical activity. D. Excessive water intake. Answer: low sunlight exposure. Rationale: low sunlight reduces vitamin D, a risk factor for MS. Option B is correct. Options A, C, and D are protective or unrelated. 124. Which finding suggests a patient is experiencing a TJ, transient ischemic attack? A. Permanent vision loss. B. Temporary speech difficulty resolving quickly. C. Steady muscle strength. D. Chronic headache. Answer: temporary speech difficulty resolving quickly. Rationale: TIAs cause brief, reversible symptoms like speech loss from temporary ischemia. Option B is correct. Options A, C, and D suggest stroke or normalcy. 125. What should a nurse do first when a patient with MS reports vision loss? A. Encourage immediate exercise. B. Assess the extent and onset of vision changes. C. Apply a warm compress. D. Ignore it as normal. Answer: assess the extent and onset of vision changes. Rationale: vision loss in MS, e.g., optic neuritis, needs assessment to guide care. Option B is priority. Options A, C, and D delay or worsen management. 126. Which complication is associated with prolonged meningitis? A. Improved hearing. B. Hearing loss from cranial nerve damage. C. Enhanced memory. D. Better reflexes. Answer: hearing loss from cranial nerve damage. Rationale: meningitis can damage cranial nerve 8, causing hearing loss. Option B is correct. Options A, C, and D are not complications. 127. What should a nurse teach a patient with ALS to manage fatigue? A. Increase daily workload. B. Pace activities and rest frequently. C. Avoid all rest periods. D. Skip physical therapy. Answer: pace activities and rest frequently. Rationale: pacing conserves energy in ALS as muscles weaken. Option B is correct. Options A, C, and D worsen fatigue or recovery. 128. Which condition is characterized by sudden loss of muscle tone? A. Cataplexy in narcolepsy. B. Parkinson's disease. C. Stroke. D. Multiple sclerosis. Answer: cataplexy in narcolepsy. Rationale: cataplexy causes sudden tone loss triggered by emotions in narcolepsy. Option A is correct. Options B, C, and D cause rigidity, weakness, or spasticity. 129. What lab test is critical before starting warfarin post-stroke? A. PT/INR coagulation. B. Blood glucose level. C. Lipid profile. D. thyroid function test. Answer: PT/INR coagulation. Rationale: PT/INR monitors clotting to prevent bleeding on warfarin. Option A is correct. Options B, C, and D assess unrelated systems. 130. Which non-pharmacological intervention helps manage stroke recovery? A. Avoid all mobility exercises. B. Speech therapy for aphasia. C. High-sugar diet only. D. Prolonged isolation. Answer: speech therapy for aphasia. Rationale: speech therapy improves communication post-stroke. Option B is correct. Options A, C, and D hinder recovery or are unrelated. 131. What is the primary transmission mode for rabies encephalitis? A. Animal bite, e.g., bat, dog. B. Respiratory droplets. C. Contaminated food. D. Direct skin contact. Answer: animal bite, e.g., bat, dog. Rationale: rabies spreads via bites from infected animals, delivering the virus. Option A is correct. Options B, C, and D fit other diseases. 132. Which symptom suggests worsening Parkinson's disease? A. Improved posture. B. Increased freezing of gait. C. Enhanced speech clarity. D. Better hand dexterity. Answer: increased freezing of gait. Rationale: freezing of gait worsens as Parkinson's progresses, reflecting dopamine loss. Option B is correct. Options A, C, and D indicate improvement. 133. What is a lifestyle risk factor for developing stroke? A. Smoking. B. High fruit intake. C. Regular exercise. D. Adequate sleep. Answer: smoking. Rationale: smoking damages vessels, raising stroke risk. Option A is correct. Options B, C, and D are protective factors. 134. Which test confirms a suspected spinal tumor diagnosis? A. MRI of the spine with contrast. B. Blood culture. C. Urine analysis. D. Chest X-ray. Answer: MRI of the spine with contrast. Rationale: MRI with contrast visualizes spinal tumors accurately. Option A is correct. Options B, C, and D assess infection or unrelated areas. 135. What is the primary goal of tizanidine in spinal cord injury? A. Cure the injury. B. Reduce muscle spasticity. C. Prevent memory loss. D. Lower blood pressure. Answer: reduce muscle spasticity. Rationale: tizanidine relaxes muscles, easing spasticity in spinal cord injury. Option B is correct. Options A, C, and D are unrelated goals. 136. Which complication is common in advanced Huntington's disease? A. Improved coordination. B. Aspiration from swallowing difficulty. C. Enhanced reflexes. D. Better memory recall. Answer: aspiration from swallowing difficulty. Rationale: late Huntington's impairs swallowing, risking aspiration. Option B is correct. Options A, C, and D are not typical. 137. What should a nurse teach a patient with migraines to reduce frequency? A. Maintain irregular sleep. B. Keep a headache diary for triggers. C. Increase caffeine intake. D. Avoid hydration. Answer: keep a headache diary for triggers. Rationale: identifying triggers via a diary helps prevent migraines. Option B is correct. Options A, C, and D increase migraine risk. 138. Which disorder causes progressive vision loss from optic nerve damage? A. Multiple sclerosis. B. Optic neuritis. C. Parkinson's disease. D. ALS. Answer: optic neuritis. Rationale: optic neuritis, often linked to MS, damages the optic nerve, causing vision loss. Option B is correct. Options A, C, and D have broader or unrelated effects. 139. What test monitors for bleeding risk in meningitis antibiotic therapy? A. Platelet count. B. Blood sugar level. C. cholesterol level. D. Kidney function test. Answer: platelet count. Rationale: platelet count assesses bleeding risk with antibiotics or complications. Option A is correct. Options B, C, and D monitor unrelated systems. 140. Which non-pharmacological strategy helps manage TBI cognitive deficits? A. Avoid mental stimulation. B. Cognitive rehabilitation therapy. C. High-fat diet only. D. Prolonged bed rest. Answer: cognitive rehabilitation therapy. Rationale: cognitive therapy improves memory and thinking post-TBI. Option B is correct. Options A, C, and D hinder recovery or are unrelated. 141. What is the primary pathophysiological mechanism of Bell's palsy? A. Dopamine deficiency. B. Inflammation of the facial nerve 7. C. Myelin overproduction. D. Cerebral ischemia. Answer: inflammation of the facial nerve 7. Rationale: Bell's palsy involves inflammation or compression of the facial nerve, causing paralysis. Option B is correct. Option A fits Parkinson's. Option C is unrelated. Option D is stroke-related. 142. Which symptom is most indicative of a subarachnoid hemorrhage? A. Gradual muscle weakness. B. Sudden, severe thunderclap headache. C. Chronic fatigue. D. Mild neck stiffness. Answer: sudden, severe thunderclap headache. Rationale: subarachnoid hemorrhage causes a sudden, intense headache from bleeding into the CSF. Option B is correct. Options A, C, and D suggest other conditions or slower onset. 143. What is a significant risk factor for developing epilepsy later in life? A. Regular exercise. B. Head trauma from accidents. C. High-fiber diet. D. Adequate hydration. Answer: head trauma from accidents. Rationale: head trauma can scar brain tissue, increasing late-onset epilepsy risk. Option B is correct. Options A, C, and D are protective or unrelated. 144. Which diagnostic test is most effective for detecting cerebral edema? A. Blood glucose test. B. CT scan of the brain. C. Urine culture. D. Spinal X-ray. Answer: CT scan of the brain. Rationale: CT scans visualize brain swelling from edema quickly. Option B is correct. Options A, C, and D assess unrelated systems or areas. 145. What is the primary treatment for reducing intracranial pressure, ICP, in TBI? A. Oral analgesics. B. For mannitol or hypertonic saline. C. Antibiotics. D. Muscle relaxants. Answer: for mannitol or hypertonic saline. Rationale: mannitol or saline reduces ICP by drawing fluid from brain tissue. Option B is correct. Options A, C, and D treat pain, infection, or spasticity, not ICP. 146. Which complication is most likely in untreated Guillain-Barré syndrome? A. Enhanced reflexes. B. Respiratory failure from diaphragm paralysis. C. Improved sensation. D. Better coordination. Answer: respiratory failure from diaphragm paralysis. Rationale: GBS can paralyze respiratory muscles, leading to failure if untreated. Option B is correct. Options A, C, and D are not complications. 147. What should a nurse teach a patient with stroke to prevent recurrence? A. Increase saturated fat intake. B. Control blood pressure and cholesterol. C. Avoid all physical activity. D. Skip regular checkups. Answer: control blood pressure and cholesterol. Rationale: managing BP and cholesterol reduces vascular risk for stroke recurrence. Option B is correct. Options A, C, and D increase risk or neglect prevention. 148. Which cranial nerve is tested by asking a patient to stick out their tongue? A. Glossopharyngeal, 9. B. Hypoglossal, 12. C. Vagus, X. D. Accessory, 11. Answer: hypoglossal, 12. Rationale: the hypoglossal nerve, 12, controls tongue movement. Option B is correct. Options A, C, and D affect swallowing, viscera, or shoulders. 149. What is a common early symptom of multiple sclerosis? A. Persistent chest pain. B. Blurred vision from optic neuritis. C. Improved balance. D. Enhanced memory. Answer: blurred vision from optic neuritis. Rationale: optic neuritis, causing blurred vision, is an early MS sign from demyelination. Option B is correct. Options A, C, and D are unrelated or opposite. 150. Which imaging is best for diagnosing a ruptured cerebral aneurysm? A. Brain CT angiography. B. Chest X-ray. C. Abdominal ultrasound. D. Knee MRI. Answer: brain CT angiography. Rationale: CT angiography visualizes cerebral vessels and rupture sites. Option A is correct. Options B, C, and D assess unrelated areas.